Hello, good afternoon to everyone who's joining us for the health and wellbeing session. I know everybody knows how all these things work by now. We've been doing it for 16 months, but if everyone could just make sure they're on mute while Victoria and Zoe are speaking, and then at the end we're going to open it up for some questions. Just as one little thing I'm just going to throw out there, just because we've been warned and it could happen. Zoe struggled a little bit with our internet. And so if that does start to be a problem, we're just going to switch over to where the PowerPoint is very seamlessly, very quickly. But that is one thing that could go wrong. Everything else is going to be absolutely perfect. So yeah, any questions anyone's got, if you just want to pop them in the chat box throughout the talks, if you just put your name and your organization, we'll get to them and we'll discuss them with Victoria and Zoe at the end. And I think that is all my housekeeping that I seem to just constantly be saying the whole day. So I'm sorry if anyone's tuned in already, bored of me saying this, but I've just got to keep going through it. And without further ado, I believe Zoe's kicking things off.
Okay. Yay, I'm on. Hi, I'm Zoe. I'm gonna share my screen first. If you just bear with me.
Okay, ready when you are.
Brilliant, thank you so much. Okay, so I'm Zoe Brown. I'm the Outreach Officer at Tyne Archives and Museums, which I'll forever now call TWAM. I've just stepped down from leading the team and I'm now studying for my PhD in adult nursing. So health, wellbeing, social care is something that I'm really interested in. So I've been asked to talk with you about the adult health and social care programs at TWAM. And today I will share with you a short version of the journey of how we've developed and how we're continuing to develop these programs. So I'll cover a very short amount of background and overview to TWAM, but also the outreach team. I'll mention a little bit of the initial internal advocacy role that took place to establish the programs. I will talk a little bit about creating the connections with grassroots clinical and community health, wellbeing and social care practitioners and professionals, a little bit on advocating the programs. I'll touch on the relationship building in the partner organisations. I will bring you up to date with the current programme development and our latest big piece of work, which is Museums Health and Social Care Service resource. A little spot of promoting of some research we're involved, it's just been launched last week. And I'm going to end hopefully on a thought-provoking quote, a bit of a call to arms for the sector. So to start with, if I could have, brilliant, slide 2. TWAM is a consortium of 9 arts and heritage venues, which include museums, galleries, Roman forts, a railway museum and an archive service. We care for designated collections in 4 subject areas of art, history, archaeology and natural sciences. And we manage the venues and services across Tyne and Wear on behalf of 5 local authorities and Newcastle University. The outreach team itself has been around for well over a decade. I think it's 15 years now, which just seems unbelievable. And it exists to connect with people using the collections as a tool. We specifically work with adults who do not currently engage with TWAM and who fit within one of the 4 targeted community engagement programs that we offer. Our adult community engagement programs are very health and wellbeing focused, as you can see. We've got the recovery program, the recovery rich program, wellbeing program, the platinum program, and the network program. And if I could have the next slide, please, Victoria. Okay, brilliant. Platinum program works with people aged over 55. The next slide, please. And recovery rich. Rich stands for recovering identities through culture and heritage. Works with people who are in addiction and justice recovery. The next slide, please. I feel like one of the guys of the COVID presentation things. Wellbeing program that focuses on working with people living with mental health issues and who are also in recovery, and it's also about people's general well-being. And the next slide, please. the network programme, and that supports groups of people who live, work and study in Tyneside, and it's a programme about museums and art galleries and archives having a social use and a value with people outside of TWAM who they work with us actively to transform TWAM spaces, the venues, the collections, the audience experience, and it often will work with people from a number of those other programmes. For all the programmes that we work with, we work in partnership with statutory and third sector organisations whose staff support people within those specialist areas that I've mentioned. Now, how do we end up with these programmes? So I think it was about a decade ago, we're going through some capacity issues. We needed to redefine what areas of work we were going to focus on, where we could make the most impact. And we've always tried to respond to what the societal challenges are for people in the North East that they face. But we wanted to really hone in and to check in again on those priorities. Has anything changed? So we took some time to find out some more through national and local research, council planning papers, reports such as the joint needs assessments are very, very important. And I think it's something that we continually ask ourselves is, how can we keep making museums relevant? How do we need to change to make sure we're relevant to people's lives? How can we be of benefit and useful to people? And how can we support people so that they can make their lives better themselves by creating environments where they can flourish? So I'm very kind of picky about the word when people talk about, oh, we empower people. We don't empower people, people empower themselves, but we create environments where they feel that they have the confidence, they feel they are able to make changes. And that's really important to me. I just wanted to bear in mind as well that most of the team come from youth community and social care backgrounds. There's a couple of people who have got museum backgrounds, but mostly we've got this other kind of an arts backgrounds as well. So that's kind of the backgrounds that we have. Some of the societal challenges you've just seen in the slide previous, you'll see high rates of disability, high rates of unemployment, high levels of mental ill health, high levels of addiction, particularly alcohol. There's high levels of chronic and long-term ill health, like comorbidities. There's an ageing population, which in itself is that's not that brilliant. It causes challenges though, and there's geographical areas with levels of multiple, social deprivation. So by identifying what the societal challenges were that people faced in the North East and what they continue to face, we're able to create programmes as a response by way of being part of a combined solution, so partnering with those specialists and statutory and third sector organisations. And way back then, we began to develop what the health and wellbeing offer and social care offer could look like for TWAM. This quote, I just wanted to point out, I think it's really, really important. In fact, I think that people, I think the time that people die earlier now was actually more than 8 years. I think it's really important. This something that I heard John McMahon, he's the senior manager for policy and research at Arts Council England. He was speaking at a conference a few weeks back, and he stated that it's the same people who live with health inequalities. They're also the people who suffer from the inequalities in access and cultural provision. I think it's interesting. I think it's probably not surprising, but I think it's very important that that connection is being talked about. It's out there. We need to do something about it. Can I have the next slide, please, Victoria? So, as you can see, challenges in the North East, in the region, we've got a few, but what's that got to do with the cultural and heritage sector? Well, firstly, we are a civic museum service. We only exist because the residents of Tyneside want us to exist. They put a significant amount of money in, the local authorities. And if we could have the next slide, please. Our mission statement. That's the second big important thing. At TWAM, our mission is to help people determine their place in the world, define their identities, so enhancing their self-respect and their respect for others. That drives us. It's come out of the work that we've done, the work that happened many decades ago. It's come out, we've stuck with it, we continue to use it. It defines who we are. So initially, in order to establish the programs, we needed to advocate internally to senior management. And my short version of my pitch was, it fits with our mission. We'll meet national and local health and wellbeing agendas. So we'll keep the council and the government on board. They will be very happy and interested in what we're doing. There's the potential to diversify income. We'll also grow our network of partners, and that means combining skills, combining resources, aligning agendas. That's all good. And also we'll continue to increase the number of people engaging in museums from the target areas. People who don't normally come to museums, will expand and broaden that. The language was really it was a really important element of the team's agenda way back then. It still is now. We were clear that we wanted it known that we wanted to deliver programs, and what we meant by programs were sustained streams of work where projects could fit underneath the program umbrella, but it showed investment and commitment to this long-term way of working. So we connected with grassroots, clinical and community health and wellbeing and social care professionals, as I say, in both statutory and third sector organisations, from organisations like the NHS, EduK, there was local walking groups, local community groups, mental health focus groups, community rehabilitation organisations, and lots of others. It just gives you a little bit of a view of the different range. At first, we set up informal meetings to discuss our work with staff. We would be meeting up with, say, occupational therapists and activity coordinators, arts therapists, challenge and behaviour nurses. Did you know they existed? Clinical psychologists, rehabilitation staff, lots of other people. And what that led to was taster sessions where we were actually able to go meet groups of people that these professionals were working with. Now, whether they call them clients or patients or service users, members, participants, again, language very important to those professionals. And we would facilitate a session, it was almost like an audition. It was so the staff could see the connections that we were making with the individuals in the group, so that they kind of went, oh, I get it, I see what's happening now. So those tasters moved on to 3-month pilots and then much longer term work, where the participants were maybe changing every few weeks to every few months, but the relationships with the workers and the organisations, that was the thing that developed, where we were understanding kind of each other's work, the nuances of each other's work, where the crossovers were, and we were kind of benefiting from that combined way of working. Key, I think, to building the relationships with the professionals and the workers was having this very open, honest and clear conversation around agendas. We identified the crossovers that we were looking at, and that's what we focused on. We found that when you can offer support to a health or social care professional, showing how you can enhance their practice, they get it, they've bought into it. And word spreads as well. Before you know it, you've got other people saying, could I do what that person has done, please? So way back in those early days, we knew that we must galvanise the interest that we were seeing from the health and social care sector in a more kind of strategic way, by taking steps to sustain this work, kind of financial, like academic, in logical terms, like the logistics of it, through kind of research partners and permission and referral pathways. And this led to projects like this on the screen, Nottingham Up North, which we partnered with Wendy Gallagher from Whitworth in Manchester, and Professor Helen Chatterjee and Dr. Nuala Morse and Dr. Linda Thompson at UCL. And that was a research project working with people with dementia, acquired brain injury, people in addiction recovery. Really interesting project. Could I have the next slide, please? Thank you. It's also, we also were heavily involved in the setting up of the Cultural Health and Wellbeing Alliance. I was a North East rep. It's now held by a couple of other TWAM colleagues. And we held the first Cultural Health and Wellbeing conference at TWAM actually in 2019, just before lockdown. Another aspiration, as I mentioned before, was to encourage the team to write papers, to speak at conferences, to get involved in research. as a way of advocating the team's work, but it was also to develop the work with other practitioners and researchers. So we had that external point of view. So we weren't becoming so kind of internalizing what we were doing. We've always, as I've mentioned before, we've always been very grassroots, which we still are, and that's deeply embedded within our practice. But what I also saw was vital was to have this kind of work researched and acknowledged at that academic level. The team and myself have subsequently co-written various peer-reviewed papers with academics and healthcare professionals. And because of the collaborations with professionals and practitioners and academics, we've written articles for the Royal College of, well, we've had co-written articles for the Royal College of Nursing Journal, Educational Gerontology, Care Talk, got a chapter in a book dedicated to Twine Newcastle Uni project, all about art therapy. We're currently co-writing a chapter on dementia and leisure with Dr. Nuala Morse, and that's for an upcoming book. So these things have slowly, we've developed them. Can I have the next slide, please? So the current work that we are developing, we've got this big piece of work, it's called the Museum Health and Social Care Service Resource. And could you put the next slide on, please? Thank you. The resource came about because we wanted to develop stronger partnerships with health and social care professionals by supporting those professionals to use museums on an independent basis. So to take away that reliance on museum staff to always facilitate group work, and we wanted to share some of the museum staff skills with the health and social care professionals so they felt confident to use the themes of heritage and culture within their care practice. And also it's about relevance, making it useful and relevant to healthcare professionals. Could I have the next slide, please? Thank you. So the resource was created with Northumbria University and a multidisciplinary steering group of health and social care practitioners and academics. So we had an occupational therapist, a physiotherapist, a mental health nurse, social worker, and older people's nurse. We also had some older people themselves as well that checked and influenced what it was. They fed into what it was that we were doing. Could I have the next slide, please? Thank you. The resource supports health and social care professionals to use museums as part of their care practice, as I said before, and this was created especially for older people, people working with older people. However, there was so much in here which is transferable, and what we are working on now is having a resource for each of the programs that we run. The collaboration, it really is about museum staff being led by health and social care practitioners to establish that clinical frame of reference, so it's relevant, so it's usable, because there's no point in just creating something nobody's going to use. It's also about crossing those, the sexual boundaries, establishing that common language that I was talking about, so that we can understand how to present creative interventions, and line them up with these clinical outcomes and improve well-being for individuals. Could I have the next slide, please? Thank you. So this is a little bit of how the resource looks. It suggests heritage activities and it identifies how these activities could specifically support health and well-being. So for example, you might have, it might talk about pain management, speech, cognitive stimulation, mental health, social interaction. And uniquely, it features searchable clinical and care outcomes that have been coded to categories like physical mobility, social, cognitive, knowledge and learning, and mindful and emotional. Could I have the next slide, please? So this is an example of one of the activities, a Roman herb garden, something that probably loads of really simple things, but when you start to look through the eyes of a health and social care practitioner, you can use it for all these other things. It's almost like a rebranding, kind of classifying, using a different language to describe what this is. So this is just a little example of that. Could I have the next slide, please? Thank you. So currently we're rolling this out regionally across social care, residential and hospital settings. We will soon be carrying Northumbria University are going to be carrying an evaluation out, and it is very focused on it's focused on the health and social care staff use of the resource. It is not about, does this activity have this clinical output? It's not about that. There is so much research out there about how creative interventions have, what their wellbeing effects are, what clinical outcomes are. This isn't about that. This is about how the staff use it. It's about whether the staff use it. It's about whether the staff are confident in using it. It's all of those things. We're just waiting to hear back. We put in for some funding from the National Institute for Health Research, something we would never have done if we hadn't partnered with Northumbria University. So again, it's diversifying funding. We're also using pre-reg, they're using the resource in pre-reg nursing education. So at Northumbria University, I believe it's the second year students, they do a module on culture and creativity in the adult nursing. So the students are using the resource. We're also using it as a basis for some of the role emerging placements. So we have a lot of occupational therapy students that come with us, and other kind of nurses as well, adult nurses that come on placement with us. And we've also now got it's our second PhD researcher, and they're actually studying the resource, which is really exciting, because the other PhD researcher that we had is on the next slide, has just brought out a book. She now works, it's Dr. Nuala Morse, she works now at Leicester University in the Museum Studies there, and she launched her book last week, The Museum as a Space of Social Care. It's about, it examines the practice of community engagement in museums through that kind of notion of care. It's specifically, it kind of uses the practices actually of TWAM's community engagement workers, of the outreach team, to explain what it is that we do and to explain her ideas. So it's been a real privilege doing that. I just wanted to share some reflections on hosting that PhD researcher of Nuala, the organisation, and the benefits of it, I think, for health and social care when you're getting into that. So the outreach team have always been a bit of a mixed bag of people, we're from different countries, different backgrounds, got different skills, but it's been really important because it leads to discussion, because we're from completely different places. We challenge each other, and that's always been really important about how we work together. So reflection has always been part of kind of our learning and our developing process. However, when you've got a researcher, and particularly Nuala because of her generosity, when you've got a researcher who is part of that process, it's given so much to us as a team of people, supporting and challenging ourselves to develop this care work. So if you get the opportunity to have it's got to be the right PhD. If you get the opportunity to do that, I would really recommend it. I think it's really important for some of this work. I just mentioned some of the differences we are as individuals, but what brings us together as a team? Well, what about the connections? So I think our values, practices, the way we show care in those practices and to each other, I think that's what we share as a team, but it's also what we share with our partner health and social care colleagues. So we've got that middle ground straight away on what it is that we're trying to do, what it's important to us and how we work. So to round up, I would say as cultural practitioners, we can and we do have a vital part in redefining and designing structures and services that support people to feel healthy and well in today's society. And I'm going to leave you with this quote. Well, actually, it's a paraphrase. I don't know if you've ever heard Professor Kevin Fenton speak. I think he was the Strategic Director of Place and Wellbeing at Southwark Council. I don't know if he is now. He's worked for World Health Organization as well, and he is brilliant. So if you ever get the chance to hear him speak, do it. But he said, we have continued to use the same tools and services and approaches to public health for the past 30 years, when we no longer live lives in the same way. How do we know the tools, services and approaches are still fit for purpose? And I think that's where we come in. So thank you very much. That's me.
Thank you, Zoe. Thank you so much. It seems very appropriate given the health and wellbeing topic that you're channeling your inner Chris Whitty there, asking for the next slide.
Yes, I couldn't, do you know, I momentarily could not remember his name, which is ridiculous. It should be, tattooed.
I feel like I've got to bring out a range of merchandise which says this, but if you have a question, please pop it in the chat with your name and your organisation, and we'll get to them at the end. In the interest of time, I will just hand over straight away to Victoria, if that's okay, and we will get on with your presentation. Thank you.
Okay, so hopefully this is where my ability to multitask completely falls out the window. So what I'm going to do in this part of the session is introduce you to the health and wellbeing work that we do at Heritage Doncaster, but primarily I'm aiming to act as a bit of a provocation to encourage you to think about staff and practitioner wellbeing as part of wellbeing programmes that you might be creating in your institutions. So more museums and cultural organisations are becoming involved in wellbeing work and engagement activities that aim to improve wellbeing, tackle isolation, and in turn diversify audiences. In the wake of COVID, more museums are going to be looking at ways that they can help with rebuilding cultural communities and assisting with some of the societal impacts that the pandemic has had. Museums are really well placed to do that work, and at no point in this presentation and I'm saying that you shouldn't, you absolutely should. And to be honest, we've basically been doing it for years as well. It's the stuff we're really good at, but it's also vital that we look after those that are doing the work as well as the participants that we spend so much time looking after. If our staff can feel supported and nourished, they're able to deliver programming that is nourishing and supportive in return. So I know that it is 4 o'clock and it's peak tea and biscuit time. So to check that you're all still with me and you're all still listening, I've got a quick minute of reclaiming your museum joy. This is a thing I like to do. So in a minute, what I want you to do is 2 things. I want you to write down, or maybe put in the chat if you're feeling brave, one thing that you love about working in museums or volunteering or freelancing, whatever it is that you do. And then the second is to describe your favourite museum object in 5 words. And then what we might do at the end is try and see if we can guess what those objects are. So you have 60 seconds to write those 2 things into the chat or on a piece of paper, starting now. And I have got a timer. Unfortunately, I don't have a countdown theme tune, so you're just going to have to trust me. And the reason I'm doing this is I think sometimes we forget to reclaim a bit of joy for ourselves, and we give all of our joy away to the participants that we work with. So hopefully this is a chance for you to remind yourselves of why you love what you do. Okay, you've got about 20 seconds left. I can see the chat thing pinging, so I know some of you are doing your homework, so that's good. Okay. So we'll crack on then. So I know there's at least 3 of you listening, so that is good to know. So museums are really well placed to deliver wellbeing work, as we've just heard from Zoe, and we absolutely should be doing this work. They are spaces that can do so many things. We can inspire. I sort of think we might be able to empower. Sorry, Zoe. We can delight and we can educate. There are also spaces that create debate. We're definitely not neutral. And on the next few slides, I'm going to introduce you to History, Health and Happiness, which is Heritage Doncaster's wellbeing programme. And then I'm going to swing in to talking about practitioner wellbeing again. So History, Health and Happiness is Heritage Doncaster's outreach and wellbeing programme. Heritage Doncaster are Doncaster's local authority run museums, and this programme is funded by Arts Council England. Our activities aim to use history and storytelling to spark conversation, improve wellbeing and tackle isolation. So simply put, we use our museum collections to enable people to feel good about themselves and their communities. And we work with a mix of people. We work with vulnerable and isolated adults, families and young people. And we recruit our own participants, often through word of mouth, but some participants are also referred into our services through social prescribing and other third sector organisations. And our sessions are delivered both in collaboration with other organisations that do this kind of engagement work really well, and we also deliver some sessions independently. But the crucial thing is they all take place outside of the museum spaces. They all take place in places like libraries, community halls, family hubs, pretty much anywhere that will have me, I'll go. Before the pandemic, our activities were mostly focused on delivering social clubs that used our collections. Like everyone, during the pandemic, we had to adapt our programming so that we're able to maintain support for some of Doncaster's most vulnerable residents that accessed our programming. We also found that we were getting more and more referrals as more and more people felt isolated for the first time. So we felt a big responsibility to look after these people. So we adapted our offer to offer some online social clubs, including the History Book Club that you can see down there. And we also created an offline programme. So we found that the digital world wasn't accessible to everybody, and for some it was a huge source of anxiety. So we created monthly activity packs that we sent to 750 residents across Doncaster every month from my front room. Crackers, I know. And we've sent around 8,000 packs so far. And going forward, we are offering a blend of in-person, digital and postal activity. What you can see on the screen is our infographics that shows all the things we did last year. So our work is evaluated by academics, so it's evaluated by Sheffield Hallam University and a consortium, ARC Research Limited as well. I'm not going to read everything out, but the key things to note is that if you put all the stamps that we put on the activity packs together, they'd be longer than the Mallard locomotive, which if you're from Doncaster is a big deal. And we also found that our social clubs, people that attend those had a 20% increase in interest in new things. So a real contributing factor to increase mental health scores. So we know that the work we are doing is making a difference to the people that we do the work for. So the work we do is important. The last slide showed that, but there is also an impact on the staff who deliver the incredible community engagement and wellbeing programmes. For me, the pandemic shone a spotlight on the invisible labour that the team undertake as part of their jobs. As well as delivering the activities, the team are providing more in-depth support for adults experiencing depression, anxiety, loneliness and grief. They also felt an incredible amount of responsibility for the well-being of participants, compounded by the fact that for the very first time, they were seeing inside the participants' homes, which meant that their boundaries were slightly more blurred. The experience has inspired me to invest in practitioner wellbeing and really bang the drum in the sector until I'm really annoying. As more and more museums move into this kind of work, as a sector, we need to look to foster a culture of care for our staff as well. Learning about the culture of care is really important, particularly as some of us stumble into wellbeing from other areas in museums like front of house or from learning. And we might not have regular clinical supervision built into our work as there is in other sectors. So what you're seeing on the screen now is a bit of anecdotal research that some colleagues at museums in other areas in Yorkshire. So this was put together by Kate from Leeds Museums. So we've recently set up a new support network for community and wellbeing practitioners called Glam Cares. And this kind of bit of research was put together to identify the good, the bad and the ugly of what people that work in wellbeing and engagement experience whilst they're at work. So I'll quickly go through this. So the good stuff. The good is when line management is mega supportive. And what this looked like is regular supervision and conversations with constructive, practical advice. The other thing that came up a lot was supportive colleagues. So a real sense of a team, the idea that you weren't in it alone, which is sometimes quite difficult if you are the only person doing this kind of work in your organisation. Something to consider though is how you offload. How can we do that effectively without burdening others? Another good thing was that during co-produced or co-led sessions where you work with partner organisations, you were able to tap into their pastoral care, having shared accountability and a shared training offer. Training came up a lot as something that's good. People like training. They wanted the training in how to have conversations about hard topics, how to refer people. But currently most of this training happens outside of the sector. So you have to go to other specialist places. And the other thing that was really good was knowing that you can ask for help and that it's okay to do so. We move into the bad. So the bad was basically the absence of all of the good, the lack of training, little supervision, and the lack of staff boundaries. So this might look like, just as a one-off, giving someone your phone number so they could let you know they got home safe. It might look like, oh, it's my day off, but I'll just check in on Beryl. Or perhaps even going for a cup of tea with your participant after the session, because you're basically buddies now, right? The other was about learning on the job. So like I said, for some of us, wellbeing wasn't how we started in museums. We might have started in learning, we might have started in curatorial, or we might have come into the museum sector from social care, and we're suddenly trying to work out what this museum world is. And the ugly, this is the really nasty stuff. Situations that were triggering to staff, impacting on their own mental health. Not dealing with situations immediately, allowing them to build up. And then social prescribing is a brilliant, brilliant thing. But where is the boundary between crisis and mental health work? And the worst case that we saw in this research was burnout and people ultimately leaving the sector. So after all that doom and gloom, what can you actually do? So this is what we're doing at Heritage Doncaster. And my hope is that by kind of suggesting some of these things, none of it is brain science. You can, I always say rocket science, brain surgery, different thing. So hopefully you can build this into any program that, that you're creating. So within History, Health and Happiness, we are focusing on developing a culture of care, and this is how we're doing it. So planning. We all spend a lot of time planning the sessions for the enjoyment of our participants, but planning them can create a culture of care too. So you can co-design not just with your participants, but also with the practitioners. So that way you can get their input on what might affect them and what they may need as you go. The next part of planning is establishing boundaries. They are really, really important in wellbeing work, but it's basically being really specific on what you will do, who you will and won't work with, and ensuring that you can have the support you need in place. For example, will you work with adults at the point of crisis? Will you work with families? Will you work at evenings and weekends? If you set these things in place, you can also set the support in place too. Something else to consider, which sounds really scary, is whether you'd be better off doing less and doing it really, really well. We understand the pressures of funding, but sometimes you might be best to actually say no. Are there others that could support on a partnership instead of you doing it on your own? And something really simple to do is to add wellbeing as an entry onto your risk assessment and look to mitigate it like you would any other risk. So think about for each session what impact it might have on the wellbeing of your staff. And then you can add in your additional training and protocols. The next bit is about listening. The key to ensuring that your staff feel supported in wellbeing work is listening. A lot of wellbeing programs are person-centred for our participants, and we can apply the same process and principles to our staff. Something to remember though is that support looks and feels different to different people and will often depend on the type of activity that you're doing. For some people, a cup of tea and a biscuit might be enough. Others might need a more kind of formal debrief, and others might be looking for mentoring, clinical supervision, or even something really creative. So as a practitioner, it might take you some time to work out what works for you. So if you're doing this work, don't be afraid to try something out of your comfort zone that might work as support for you. And then you can ask for that going forward. As a manager, be willing to try something out of the ordinary framework, something that is absolutely terrifying for local authorities, but something that is very important. And finally, as a manager, a key part of the culture of care is also demonstrating the value of the work that you do. Advocate for the power of the work where you can, all the time, and also build in time for some reflective practice. Reflection isn't just looking at what went wrong, it's also celebrating achievements and valuing your team. Reflection enables people to thrive, teams to grow closer, and projects to flourish. And the last bit is about self-care. A really important part of the culture of care is, so it doesn't all have to be top down, but you need to encourage self-care within your teams. As a manager, you can foster an environment where self-care is supported and seen as a necessity rather than an indulgence. Self-care does not just mean bubble baths and chocolate. It might also look like space for breaks, debriefs, or even time for counselling or other reflective practice. So personally, as a manager, I have a budget line for self-care so that my team are empowered to pursue what they need as they are the experts on themselves. So what that might look like is one of my team saying, hey, I've seen this really cool book about stress management. Can I buy it? As a practitioner, you can try and block out time in your diary. I know it's easier said than done, but one thing we're really focusing on at Heritage Doncaster is reclaiming our lunch. So turning down lunchtime meetings, actually going outside and actually eating that's not in front of your desk. And the other thing to remember is you're never in this on your own. Even if you're the only person working on wellbeing work in your organisation, there is a whole network of people out there. And we've just launched Glam Cares, which you can find on Twitter, who are a network that are doing just that. We are bringing people together to talk about these issues. So I'm not going to do this now because I haven't got a lot of time, but this could be your homework if you're feeling bold. You might want to watch this back and then think about an example of a realistic boundary that you could put in place for one of your programs or for something in the future. And also an example of self-care at work that you are going to commit to. If we were at a conference, this is where I'd make you write it on a postcard and send it to yourself, and you'd get a reminder in 6 months about what you haven't done. So rounding this up then, and I'm almost bang on 10 minutes, I'm very pleased with myself. Remember, when you're doing the wellbeing work, to plan your programming and to build in the support from the very beginning. Don't try and retrofit what you need. Don't be afraid to say no to an activity you don't have the experience or understanding of, or if you've got too much on, set your boundaries that allow your teams to flourish. 3, listen to your teams and then listen again to explore what they really need for support. 4, you're not on your own. There is a network of us and partnerships you can form in your own communities. You don't have to do everything. And finally, find your museum joy. Remember why you do what you do and hold on to it. And that's me.
That was brilliant. Thank you, Victoria. And also, in about 5 minutes, you managed to get more people to post in the chat than the last 7.5 hours I've spent desperately trying to get people to do it. So well done. We have a couple of questions, I think, from earlier on that were posted. One from Richard Hall, who it's nice to see again, who's one of our speakers earlier. He says, hi Zoe, fascinating to learn about the work you've been doing. How did you match up with partners who shared an interest in this area of work?
Okay, can you hear me now?
Yep.
I was on mute, sorry. We're part of lots and lots of networks. So once you start doing work in this area, we'll often have people come to you. We have an awful lot of conversations and they may not go anywhere. You whittle it down to the people that you think you can best work with, and there's kind of different criteria that we're looking at. We're looking at agendas, we're looking at where there's crossover, we're looking at the kind of what a partner can bring to the table. And I'm not talking necessarily money, I'm talking about a commitment to a certain amount of time or being involved in kind of evaluation or sharing data that they're allowed to. And you get a sense of how people are when you start doing tasters and you start seeing what their commitment level is. Yeah, that's how we find people.
Thank you for that, Zoe. And we've also got another question from Rosie at Birmingham Museums, who this is directed to you as well, Zoe. It said, you mentioned that many of your staff are youth or community workers. How has that worked in terms of any restrictions set on using the museums or collections? And can you say how many there are in your teams / working on each programs?
Yeah, we've got one person working, and they're most of them part-time, one person working on each team, each program. There is myself and because I've just gone part-time because I'm doing my PhD, and Sophie Mitchell has just become an outreach officer, so she was working on the wellbeing program. There has been times when we've had about 17 people in the team. It depends. project funding is such that we can often have different projects underneath the umbrellas of each programme. The reason why we run it in this way is that there will always be something happening under those programmes, even if there isn't a load of project funding that's come in for separate, separate projects, because it keeps that continuity going. So yeah, at the minute, we're all part-time apart from one person, and there's 1, 2, 3, 4, there's 6 of us, but we're all part-time apart from one person. So yeah, it's quite a small team for the amount that we get, the amount that we deliver. And what was the other part of the question about collections?
Yeah, it was. How has that worked in terms of any restrictions set on using the museums or collections?
Well, we've had training using some of the collections where we can, but often, obviously there's some collections we're not just going to be able to go in and kind of touch. We've had training on going into the stores, and actually even bringing some groups into some of the stores. But we work very, very closely with the curatorial staff. They're absolutely amazing. Why would we try to do some of the curatorial stuff when we've already got curatorial staff there? They know about the stuff, they're about the collections. When we're working with a group, we're not saying we know about all this stuff. We're saying, we're kind of learning with you, and that's what's happened, and we're just kind of, to be honest with you, I think we're just all naturally really nosy people. So it works really well, and obviously we're very people, so we do like kind of work with lots of different teams, and bring that multidisciplinary thing in. It just works really well, and it also can be really, really challenging. It's not all kind of unicorns and rainbows.
Thank you for that, Zoe, and thank you, Rosie, for that question. I was just wondering, Victoria, you said on the good, the bad, and the ugly slide about bad line management being a problem for people, and then also later on when you were just summarising, you said that obviously people, if they need it, should access support. I was just wondering sort of what mechanisms, what organisations are in place to support people, or do you think this is an area that maybe needs a bit more emphasis?
Yeah, I guess so. That's part of the reason that we formed Glam Cares, is that so what Glam Cares started off as was 4 of us that work in this field of work getting together and having a bit of a whinge, and the more we spoke to other people that work in engagement or in this wellbeing work, people were saying, we're talking about this kind of emotional labour and the kind of, what do you do when this happens? You're doing a session that you think it's just going to be about mining, and next thing you know, you're over here and it's something, someone's talking about some really intense trauma. So some places are fortunate where they have clinical supervision built into their work. It's not the case for us, so that's why we try and foster this kind of culture of care, so that it's a bit kind of easier to talk about these issues. But yeah, it's definitely an area that I think as more and more museums get involved in wellbeing work, they're not always putting in the support for the staff to do that work. A lot of that is because museums are pursuing the work because there's funding there. There is funding in recovery programs, there's funding in like recovery from COVID, there is funding in wellbeing, but you need to put a portion of that budget aside for also looking after the people that do it. So I know it's an area that the Culture, Health and Wellbeing Alliance are also looking at, and so are the Museums Association, so it is being considered. But yeah, if anyone wants to come and join Glam Cares, we kind of get together now and again and have a chat, and we launched a couple of weeks ago, and it seems like it's needed, let's put it that way.
Brilliant, that's great, thank you. That's we've been through all the questions in the chat there, and if anyone fancies looking in the chat, there are some great responses to the little challenge that Victoria set.
I want to know what these objects are, so if anyone wants to share, or if anyone has any pictures, just
yeah, I mean, if anyone right now fancies telling us what the objects were they mentioned, please do. Oh, there we go.
Oh, the suspense.
And then should I screen share this so everyone can see?
Yeah. Oh, that's gorgeous.
A mammoth tusk.
Oh, Water brine pump. Amazing. I would never have got that. Ooh. So this is where like the professionally nosy bit comes in. That's what this is. Wow.
Mm-hmm. Oh, they've got some great responses to that. But I think now we've been through all the questions, and I think we're getting towards the end of this session, moving on to the next session. It's probably a good time to call it a day. But thank you, Zoe and Victoria, so much. It's been really interesting. Obviously, as I think I said earlier, this session will be recorded, as it's been recorded throughout, and it will be downloaded. And in the next couple of weeks, you can all access it to watch it back. And obviously, I'm sure there'll be plenty of people watching who haven't been able to join us today. But no, thank you so much for your time. It's been absolutely brilliant. And thank you everyone who's joined us to watch.
Yeah.
Thanks a lot.